graduating in February of 2021. Aaron took a job in Santa Rosa. He was there for 2.5 years, and he decided, you know what? It's time to do my own thing. So now Dr. Aaron Goodsight is on his own, and he is building his practice here. He's an avid rugby player, self-proclaimed career student, and bar splitter. Without further ado, here's Dr. Aaron Goodsight.
Thank you. How is everybody doing today? All right. Welcome. We're going to be quick. Just to reiterate, MS is Master of Science. DC is Doctor of Chiropractic. CSCS is Certified Strength and Conditioning Specialist. And a Certified Bar Spitter, not Splitter. They're spitting them out on the street. We got bars for days. All right. So I know you hear me talk about this a lot. We talk about the root cause and getting to the true meaning of what's going on. But I realize not everybody knows what my language is. So today we're going to talk about what that is. All right. Is that good for you guys?
Yeah.
Is that good for you guys? Come on, let's get a little enthusiasm, man. Fuck, it's tired, it's boring. All right, so step one. What is this root cause that you keep talking about? The root cause is the actual reason you have pain. The kicker is it's usually not in the area that you have the pain, because where you have the pain is usually the victim, not the culprit. Does that make sense to everyone?
Yes.
All right, cool. So what we have here is a buddy of mine. Met the other day. He's an avid golfer. He's a golf pro, professional golfer. He's been dealing with low back and hip pain for years. And now every time he takes a swing, he gets excruciating pain behind his left shoulder blade. So what does he do? He goes to the chiropractor. He gets adjusted. He gets massaged. He stretches, all of that. Nothing works, right? Why? Because they might not have found the actual reason. It goes away for a little bit and comes back. So what do? We take him through a test. We look at his rotation. When he rotates to the right, look at his hips. Little movement, nothing, pretty symmetrical, right? Can we all agree to that? All right, we can agree, right? Yeah. All right, come on, guys. Like, fucking wake up. There's not a lot of us. Let's have some fun. All right, but when he turns to the left, what do we see with this hip? It pulls in. I'm sorry? It pulls in. Yeah, it pulls in. It lifts up. That muscle, I don't know if you can see the detail, but a little contraction here, big contraction here. Do you guys see that? All right, so there's something going on with the rotation for his hip, right? We know when he rotates his hip or with his back, he feels it in his hip. Boom. Every time you swing a golf club, what do? You rotate. Maybe that's why his hip hurts. So then we do a different change of rotation because joint angle dictates muscle fiber recruitment. What that means is the way you're standing, the way your muscle activates. Here's different than that. So we bend him over, more similar to a golf swing. Again, rotate to the right. Can you guys all see how that's nice and smooth right there? Then when we rotate to the left again, his shirt's bunched up. He's lifting. He's hunching. Does that all make sense? And so we realize, oh, by the way, it reproduced the pain. So we realize maybe it's not his shoulder that's the problem. Maybe it's his rotation. And that's where we attacked. Next step, I need a volunteer. I talked to JR in the beginning. Sorry about that. He beat you to it. So let's have JR pop up, sit over here. What's bothering you, my friend?
Everything from here down to here.
All right, one thing. We're on a time limit. One thing.
Right.
We talked about the shoulder blade, right? All right, so no. We're finding the root cause. We're not just fixing you willy-nilly. Just because something works for her doesn't mean it's going to work for you, right, buddy?
That's true.
All right, let's have you take a seat.
Okay.
All right, so first thing, uncross your legs for me, please. First thing, what have you done for your shoulder so far?
The hypervolt and stretching.
Okay, and is it lasting?
Sort of, because I don't do it all the time.
So. Okay, cool. So what we're going to do the same thing that my buddy
I know Will that's in the picture. I golf.
Yeah.
I know his exact problems are my problems.
Yeah, so here we go. Let's go. Arms up like this. I'm going to ask you to keep your nose and your chin right over your chest, okay? And let's have you rotate to your right. Okay, good. And then back to the middle. And let's have you rotate to the left. Good. And back to the middle. Did you have any pain with that?
Yeah.
Which rotation? When you rotated to the left? All right, so do that again. Okay. And then back to the middle. And then rotate to the right. Okay, good. But you had it when you went to the left.
Yeah.
Let's do the left one more time. Good. And back to the middle. So what I want you to do now, also kind of interesting, he had the pain when he turned. I forgot my yoga block, so let's have you stick this between your knees and do the same thing. Good. Any pain with that?
No, not too bad.
And then the other way?
A little tight.
Still a little tight, better or worse?
A little better though, with the knees spread out like that.
Okay.
Nice.
And let's try it this way.
Okay.
And don't drop that. There. And do it again.
Yeah.
What about?
Back crack you?
Yeah.
Hey, that's called a free adjustment. So,
Gotta pay for that.
did it decrease when you closed your legs and held the box more?
Yes.
Right. So, what does that tell us? Maybe his hip stability is not is the issue contributing to his shoulder, because when he rotated without the hip stability, right, and we didn't force his hips to stay stable, what happened? He had the pain.
Correct.
When we forced his hips to stay, the pain went away and his back released. So when we think about what we're treating and why we want to treat people in certain ways and why I spend 60 minutes with people and why I emphasize the free consultation and the phone call, it's because, yes, it was awesome you gave me all your information in 5 seconds, but we also pre-chatted. But imagine what we could solve if we had an hour conversation, an hour free session, and then we spend an hour every time we visit it. Exactly. So my job as a facilitator to figure out exactly where your issue is, because the people that are doing the effort, that are going to the massage therapist, that are doing their stretches, that are doing the hypervolt, they can then take control of their life and be the hero of their story. Does that make sense? I'm just Mr. Miyagi over here. All right. Thank you.
Yep. Thank you.
You're welcome. All right. So as we go on, obviously I got to give my pitch. That's why we're here, right? So do you know someone who is tired of dealing with the same issue that comes back and goes away and comes back, or really never even goes away? They tried this and they tried that and they had a temporary fix, and maybe it's not, every 2 months. Now it's maybe every 6 months, but it's still kind of holding them back from doing the things they love. Do you know somebody who's sick and tired of their physical therapists or their doctors or their chiropractors not listening to them, rushing them out of the door, or passing them off to somebody else? Are you tired of going to a chiropractor or a physical therapist or even your MD and getting a quick 5-minute appointment, them giving you some quick anti-inflammatories or Norco and sending you on your way? If you or anyone you know like that, please send them to me. We're not dancing in the music videos. We're Suge Knight over here, Death Row. All right. So send them to Connect Rehab Chiropractic and Performance, where we can fix the root cause and give you the tools to be the hero of your story and stay in the game for the long term. So, here's my information. Please go ahead and snap a picture, especially that Instagram. If you want top value, top quality, great information, follow me on Instagram. It's pretty awesome. Any questions? Actually, sorry, I phrased that wrong. What questions do you have? Because I know you have a lot.
What do I do for a reoccurring injury that comes on and goes away, comes on and goes away? It's in the soleus. It's I'll sprint and it'll hurt for a couple of days, but this is my worst case. It's been a couple of weeks now. I'm struggling with posing and hitting issues.
Possibly, it could be a reason, but it's looking at the body as a whole, right? Let's look at our gait. Let's look at our running patterns. Let's look at the shoes, the area that we're running in. How are you controlling your feet? As you're hip flexing, right? How are your hips flexing? Where's your foot strike? So you want to look at all of those things. Again, it could be because when you're sprinting, right, you're in this position. What if your head is kind of stuck this way, right? And now you're stuck this way. So now your foot strike is here rather than back here. So you're hitting it harder and you're not able to push off. Maybe you have a disengaged muscle in your hamstring that's forcing that calf to have to press harder than the hamstring pulling. Does that make sense? So it's really sit and chat and figure it out and spend some time.
Now, how long do you, let's say we've gone through the hour and then I come back for the second and third appointment. How long do you usually spend on an appointment like that? Because my last chiropractor, it's like you said, come in.
60 minutes every visit.
Oh.
Yeah, nothing less. It might be 55.
Yeah.
But
my guy's 15 minutes.
Yeah, no.
So see you later. I got the next person.
And so, no, not at all. That's why I walked off my job, because people weren't getting better. And I was told that I was wrong for wanting to help. And if we're not coming from a place of service and if we're not listening, then what the fuck are we doing? You know what I mean? Excuse my language, but if we're going to be completely real about the situation, what are we doing? If we're not here to provide the service and help, bro, you can go be an engineer in an office by yourself. You know what I mean? That's not why we're in the service industry. So, yes.
What
Stabilize your core. Anterior, posterior, and laterally through dynamic movements. And look up spine sparing exercises. Sparing. Yeah, spine sparing exercises and foot health. So I wouldn't depend on inserts. I'd depend on strengthening your arches. So that would be my first step.
What if I had a inflamed knee?
Answer your phone when the chiropractor calls you. I'm joking.
Gotcha.
But what's up?
Yeah, so what if I have a bad inflamed knee
Mm-hmm.
that, like, not due to an injury,
Mm-hmm.
just one knee,
Mm-hmm.
don't do anything weird,
And
but just gets worse with exercise?
yeah, so that actually would be a perfect thing for checking the root cause because we know that the knee is like an intersection, right? So you have 4 muscles on the front, 2 muscles on the back, one here, another muscle that comes across here, right? And then you have 3 calf muscles that insert on the back, and you have a tibialis anterior. You have a ton of muscles that all intersect on the knee, right? And so if you have like a non-traumatic injury, we know that it's 10 times out of 10, 9 times out of 10, the knee is not the issue, right? The knee is the victim. So we're going to check from pretty much your head down to figure out exactly where that imbalance is coming from that's causing that pressure to be centered on your knee. Does that make sense?
Yeah.
Yeah. Yeah. All right. Thank you. Thank you.
Totally fixable is what he's saying.
Yes. With time and effort.
I thought I might have arthritis.
No. How old are you?
32.
Nah. I mean, so here's the thing about arthritis too, though. We all have it, right? Most people have arthritis. Arthritis is simply, you get a callus on your bone, right? Like, raise your hand if you don't have a callus, or raise your hand if you have a callus. Somewhere, on your feet, your hands, somewhere. Oh man, y'all are fancy. You know what I mean? And so, like, just because you have a callus doesn't mean it's gonna rip off, and it doesn't mean you're gonna have pain. Why do you have that callus? Why was that bone being degenerated? What caused the change in your biomechanics to put the pressure abnormally on that joint to cause the wearing away? And if we can alleviate that, we can take most times, obviously, if you're like 20, 30 years down the road and your knee is like this, right? I'm not saying I'm fixing that, but we can figure out why you have it. And there's a chance that if we can relieve that pressure, even though you do have arthritis, it's not going to have that same effect as if it was if you were still staying in that same position. Yeah.
You recommend heat or ice? I know it's kind of weird.
No, it's not a weird question. It's a real good question. Both is the answer. I personally, so scientifically speaking, ice is not the most beneficial thing to use, especially more than 24 hours post-injury. Heat is where you're going to get all of the good stuff, the blood flow. Inflammation, I know we talk about it as not as a good thing, as a bad thing, but technically is a good thing, and it brings in the healing factors. It's when it stays too long. So you want to use the ice to bring in the heat, bring in the blood flow, bring in the nutrients. But in the acute injury case, ice is great because it will help to flush everything out and get out the initial inflammatory markers that are more of the painful, stabilizing, swelling ones. And then, so you flush that out, then you bring in the heat, which brings in the good stuff, and then could cause a little pain, but then you would use the ice to ease that, and then you would cycle back and forth. I personally, if you can handle it, I prefer to finish on heat so you get the blood in there for the long term. If it's too much for you, especially in the beginning, you can finish with ice, but heat, I always say, is the best option. Yeah. Thank you.
All right.
Yeah.
Thank you.
All right. Thank you, guys.